Hello everyone. We are going to start a very interesting topic related to human physiology today, and the topic is respiratory system. We will discuss its anatomy and physiology in the current lecture and then its functions in the upcoming lectures in detail. So let's start our today's lecture on respiratory system. Actually, our today's lecture is related to anatomy and physiology of the respiratory system. First of all, what is the respiratory system? The respiratory system is the organ and other parts of our body that involved in breathing. When we exchange oxygen and carbon dioxide, that is, we exchange gases, it means that when we inhale gases and we exhale gases. Our respiratory system includes, first of all, nose or nasal cavity, sinuses, mouth, throat that contains pharynx, voice box also known as larynx, windpipe, trachea, diaphragm, lungs, bronchial tubes or bronchi, bronchioles, air sacs also known as alveoli present between the lungs, and the capillaries. The very important question is that how do we breathe? So we can say that breathing starts when we inhale air into the lungs through nose or mouth. The air travels down the back of the throat and passing from windpipe. The windpipe is then divided into air passages which are called bronchial tubes. From the lungs to perform their best, these airways need to be open. They should be free from inflammation or swelling and extra mucus to avoid any bacterial infection. What are functions of the respiratory system? The main functions include gas exchange, ventilation, gas exchange between blood and lungs. Ventilation, that is moving of air in and out of the lungs. Respiratory system also helps to produce sounds. It protects from bacterial or fungal infections. It causes acid-base balance in the body and also control blood pressure. So we will look into detail all these functions. First of all, gas exchange. How respiratory system helps to exchange gases between blood and lungs. The respiratory system is responsible for moving air to and from exchange surfaces of lungs. Three main gases of air which include nitrogen, oxygen and carbon dioxide. Nitrogen composes 78% of air, while oxygen and carbon dioxide just composes 21% and less than 1% of air, respectively. That is, oxygen is present around 21% in air and the carbon dioxide percentage is 1%. The gases that our lungs exchange, they are oxygen and carbon dioxide. So the question arises, if nitrogen is so abundant in the air, why don't we breathe nitrogen instead of oxygen and carbon dioxide? This is an excellent question, and the answer is based on Henry's law, which states that when gases come in contact with a liquid, the gas would dissolve into the liquid in proportion to its partial pressure. While this is true, the amount of gas that will dissolve into the liquid also depends upon the solubility of the gas. So we can note here that now there are two factors, partial pressure and the solubility of the gas. Thus, the Henry's law states that the concentration of gas that dissolves in a liquid is directly proportional to both the partial pressure and the solubility of the gas. That is, it is directly proportional to the to both factors. Now, nitrogen is insoluble in plasma, lungs, and tissues. So in fact, out of all three of the main gases, carbon dioxide is the most soluble in the plasma and is 20 times more soluble in plasma even than oxygen. So we can say that oxygen and carbon dioxide being soluble in the plasma are exchanged, and nitrogen, while nitrogen is not exchanged. The respiratory system provides extensive surface area for gas exchange to occur between our circulating blood and air. Gas exchange specifically occurs in the alveoli, air sacs of our lungs. Many blood vessels surround each air sac, exchanging carbon dioxide from deoxygenated blood for oxygen from the air. The next very important function is the phonation, that is to produce sound. Yes, you may be surprised, but our respiratory system all helps in the production of sound. The vocal cords in our larynx, as you can see here, the two vocal cords in our larynx, they help with the production of sounds. Pitch can be changed accordingly based on the thickness or length of the vocal cords. That is, the phonation actually is the production of sound by the movement of air through these two vocal cords. Speech, singing, and other sounds, they are produced by the actions of the central nervous system controllers on the muscles of respiration, causing air to flow through the vocal cords and the mouth. Phonation will be discussed in detail in the upcoming slides. Thick and shorter vocal cords, they produce low tones, while thin and slender and longer vocal cords, they produce high pitched tones. So the structure of these vocal cords is very important in the quality of sound. The loudness of our voice, it comes from our vocal cords, but rather from the amount of force of air that we breathe in or let out. The next important function of respiratory system is the pulmonary defense mechanism, or the protection against bacteria or germs. Each breath brings into the lungs a small sample of the local atmospheric environment. This may include microorganisms such as bacteria, dust, particles of silica, or any other toxic gases like smoke coming from cigarette and other factories, etc. And even some other pollutants present in the air. In addition, the temperature and humidity of the local atmosphere very tremendously affects the breathing. So the outside environment can contain, as we know that outside environment can contain many unwanted particles, such as it may also include pollens. Some people have pollen allergy, dust, viruses, and bacteria. So our respiratory system ensures to protect respiratory surfaces from these outsiders. Example include cilia from our mucociliary mucus and dust cells or macrophages. The mucociliary explorator sounds like what it is. The cilia, they are actually the cilia in our bronchi that beat rapidly to propagate mucus trapped debris or particles up from our lungs and into the pharynx. The mucus is either spit out from the mouth or swallowed into the esophagus to the stomach, where the trapped bacteria, dust, or any other viruses, they are dissolved and broken down by the stomach's strong acid content. While dust cells are also known as the macrophages of the lungs, these fellows swallow foreign objects or invaders non-specifically through phagocytosis. So this is the scanning electron microscopy diagram that shows that cilia, they have trapped the macrophages, the round particles of macrophages. Then comes the acid-base balance. Our pH is regulated by our respiratory system as well, that exchanges carbon dioxide and oxygen As we can see here in this diagram, the oxygen and carbon dioxide are exchanged from our lungs and blood with the air. The respiratory system can therefore participate in acid-base balance by removing carbon dioxide from the body. The central nervous system has sensors for the carbon dioxide and the hydrogen ion levels in the arterial blood and in the cerebrospinal fluid that send information to the controllers of the breathing. Acid-base balance will be discussed in the upcoming lectures. Carbon dioxide actually it acidifies the blood and lowers the pH, while lungs of our respiratory system they respond by respiring faster, exhaling out carbon dioxide rapidly and inhaling more oxygen in order to balance the blood pH. Then comes pulmonary metabolism and handling of bioactive materials. The cells of the lung must metabolize substrates to supply energy and nutrients for their own maintenance. Some specialized pulmonary cells also produce substances necessary for normal pulmonary functions. In addition, the pulmonary capillary endothelium contains a great number of enzymes that can produce, metabolize, or modify naturally occurring vasoactive substances. The next function is olfactory. Thanks to our nose and nasal canal from our respiratory system that we can participate in olfactory senses, that is sense of smelling. Another very important function is the regulating blood pressure and blood volume by the respiratory system. When our blood volume and blood pressure are low, our lungs contain an enzyme which is called ACE that converts angiotensin 1 to angiotensin 2 on the surface or the pulmonary endothelium. Angiotensin 2 is the peptide hormone that stimulates other organs and systems to help increase blood volume and blood pressure. For more on the ACE enzyme and angiotensin, we have already discussed it in our hormonal lecture. So, after all this discussion, we can conclude that the primary function of this system, that is the respiratory system, is to furnish oxygen for individual tissue cells and to take away the waste products and carbon dioxide produced by those cells. There are two types of respiration: external respiration and internal respiration. What is external respiration? It's the process of inhaling oxygen into the lungs and exhaling carbon dioxide out of the lungs. That process includes the ventilation of the lungs and the exchange of air in the lungs and blood within the capillaries of the alveoli of the lungs. While what is the internal respiration? It's the metabolic process by which living cells use blood flowing through the capillaries and absorbing the oxygen they need and releasing the carbon dioxide they create, and that is extra in our blood. The structure of the upper respiratory tract. Look upon the diagram that shows us some important parts of the upper respiratory tract. Cavities within bones surrounding the nasal cavity. We can see here, first of all, the frontal sinus, then comes cribriform palate of ethmoid bone here. The nasal cavity, then comes the nasal cavity in light pink. The nasal cavity has three projection bones, bones-like projections. They are known as superior concha, middle concha, and inferior concha. Then comes the external layers, that is the opening of the nose. The nasal cavity is separated from the upper jaw through a palate. There are two portions of the palate bones, hard palate and soft palate. The inferior one is the soft palate. Then comes tongue and the lingual tonsils. Actually, we can say that oral cavity is not a true part of the respiratory tract. But as sometimes air can also enter through the mouth instead of nose. So up to some extent, oral cavity becomes a part of the upper respiratory tract too. Then comes epiglottis and the glottis, the portion that separates digestive system from the respiratory system. Hyoid bone here lies thyroid cartilage of larynx, and we will study in detail in next slides, in our upcoming slides, the structure of the larynx. There is a portion of thyroid cartilage of larynx, cricoid cartilage of larynx. Then comes thyroid gland and trachea. While on the other side, on the inferior side, we can see here esophagus and then the vocal fold present in the larynx, laryngopharynx region, oropharynx region, as the pharynx contains three regions, nasopharynx, oropharynx and the laryngopharynx region. Here lies pharyngeal tonsils and sphenoidal sinus. Functions of the sinus. What is the function of the sinus? They lighten the skull and act as resonance chamber for speech, and also produce mucus that drains into the nasal cavity. The nasal cavity. The external opening of the nose is the nostrils or interior nares. The dividing partition here between the nostrils is the nasal septum, which forms two nasal cavities. Each cavity is divided into three air passages: the superior, middle, and the inferior. Now, if we look into detail the structure of nasal cavity, we can look that we can notice that the upper respiratory tract begins with the nasal cavity actually. The nasal cavity opens interiorly on the face through the two nares here. Um, Also we can see here, and posteriorly into the nasopharynx through the two concha. The floor of the nasal cavity is formed by the hard palate, as we have already seen in the last diagram, while the roof consists of the cribriform plate of the ethmoid bones posteriorly. The cribriform palate is present here. The nares and interior portion of the nasal cavity contains sebaceous glands and hair follicles that serve to prevent any larger harmful particles from passing into the nasal cavity. The lateral walls of the nasal cavity contain three bony projections called nasal concha: the superior nasal concha, the middle nasal concha, and the inferior nasal concha. They increase the surface area of the nasal cavity. The nasal concha also disrupt the laminar flow of air, making it slow and turbulent, thereby helping to humidify and warm up the air to body temperature, as sometimes we inhale the air that has very low temperature. So this cavity helps to bring air temperature into the optimum condition. The roof of the nasal cavity contains the olfactory epithelium here, the olfactory region, which consists of specialized sensory receptors. These receptors pick up airborne odorant molecules and transform them into action potentials that travel via the olfactory nerve to the cerebral cortex, allowing the brain to register them and provide a sense of smell. As we have already seen in the functions, that olfactory function is a very important function of the respiratory tract. We can smell things through airs. Another pathway for the entry of air is the oral cavity, although it is not classified as a part of the upper respiratory tract, but the oral cavity provides an alternative route in the case of obstruction. The nasal cavity, like during flu or any other respiratory disease, the oral cavity opens interiorly on the face through the oral fissures, while posteriorly it opens into the oropharynx through a passage called the oropharyngeal isthmus. Olfactory receptors are located in the mucosa on the superior surface. The rest of the cavity is lined with respiratory mucosa that moisten air and trap incoming foreign particles. So the lateral walls have projections we have already seen called concha, and the nasal cavity is separated from the cavity by the palate, hard and soft palate. The concha passage lead to the passageway called the pharynx. Here in the front diagram of the nose, we can see that the ear is connected to the sinuses. The ears through the eustachian tube and even the eyes through the nasolacrimal ducts. They are connected. Here in this diagram, we can say lacrimal sac and the nasolacrimal duct. Nasal sinuses. They are several bones that form the walls of the nasal cavity and contain air-filled spaces called the paranasal sinuses, which are named after their associated bones like maxillary, frontal, and sphenoidal, and even ethmoidal sinuses. Here comes the sphenoidal sinuses. Here comes the frontal sinuses. Two sinuses are seen here. The paranasal sinuses, they communicate with the nasal cavity via several openings and thereby also receive the inhaled air and contribute to its humidifying and warming. In addition, the mucous membrane and respiratory epithelium that lines both the nasal cavity and the paranasal sinuses, they traps any harmful particles, dust or bacteria. The palatine or the palate bones here and the maxilla bones, the upper jaw bone, they separate the nasal cavities from the mouth cavity. Cilia or the hair that lines, cilia hair that line the mucous membrane, they are about 1/4 of the mucus is produced daily. And these ciliary hairs, they are used to trap foreign particles, not needed for the respiratory system. So after passing through the nasal cavity, the paranasal sinuses, the inhaled air exits through the cornea into the pharynx. The pharynx is the funnel-shaped muscular tube that contains three parts: the nasopharynx, oropharynx, and laryngopharynx. The pharynx is the correct term for the throat. It is muscular and membranous tube that is about 5 inches long and extending downward from the base of the skull. It eventually becomes the esophagus. The nasopharynx is the first and the supermost part of the pharynx, found posterior to the nasal cavity. This part of the this is the nasopharynx. This part of the pharynx serves only as an airway and is thus lined with respiratory epithelium. Inferiorly, the uvula and soft palate swing upwards and during swallowing to close off the nasopharynx and prevent food from entering the nasal cavity. Then comes the oropharynx. The oropharynx is found posterior to the oral cavity, as we can see here, the posterior to the oral cavity, and communicates with it through the oropharyngeal isthmus. The oropharynx is a pathway for both the air incoming from the nasopharynx and the food incoming from the oral cavity. Thus, the oropharynx is lined with the more protective, non-keratinizing stratified squamous epithelium. Then comes the last part, the laryngopharynx, or also known as hypopharynx, is the most inferior part of the pharynx. It is the point at which the digestive and respiratory systems diverge. Interiorly, the laryngopharynx continues into the larynx, whereas posteriorly it continues as the esophagus. So, We can say that pharynx is the muscular passage from nasal cavity to the larynx. Three regions of the pharynx, that is the oropharynx, laryngopharynx, they are common passageways for air and food. Auditory tubes enter the nasopharynx. Tonsils of the pharynx include pharyngeal tonsil, here pharyngeal tonsil in the nasopharynx, palatine tonsil in the oropharynx, this is the palatine tonsils, and the lingual tonsils at the base of the tongue. In this diagram, we can see that the nasopharynx is behind the nose, the oropharynx is behind the mouth, and the laryngopharynx is behind the larynx. There are 7 openings into the pharynx. In the nasopharynx, there are 2 openings from the eustachian tube of the ear. Here we can see here, and the 2 openings from the posterior nares of the nose, the yellow, the blue, and the green one. The pharynx also contains 3 pairs of tissues that are part of the lymphatic system. We have already seen that there are 3 tonsils, the pharyngeal tonsils also known as the adenoids, and palatine tonsils and lingual tonsils. The pharynx has 3 important functions. Number 1, it serves as a passageway for air, it serves as a passageway for food, and it also aids in phonation by changing its shape. Then comes the next portion, larynx. Following the laryngopharynx, the next and last portion of the upper respiratory tract is the superior part of the larynx. The larynx is a complex hollow structure found interior to the esophagus. It is supported by a cartilaginous skeleton connected by membranes, ligaments, and associated muscles. Above the vocal cords, the larynx is lined with stratified squamous epithelium, like the laryngopharynx. Below the vocal cords, this epithelium transitions into pseudostratified ciliated columnar epithelium with goblet cells. Besides its main functions to conduct the air, the larynx also houses the vocal cords. As we can see here, the white rods or the white lines, they describe the vocal cords that participate in voice production. The laryngeal inlet is closed by the epiglottis during swallowing to prevent food or liquid from entering the lower respiratory tract. The epiglottis lies here. The larynx, commonly called the voice box, is located at the upper end of the trachea. Upper end of the trachea, below the root of the tongue and hyoid bone. It is lined with the mucous membrane. What are functions of the larynx? So the larynx contains vocal cords which produce sound. Short tense vocal cords produce high notes while long relaxed vocal cords produce low notes. It routes air and food into proper channels. It plays a role in speech and is made of 8 rigid hyaline cartilages and a spoon-shaped flap of elastic cartilage which is known as epiglottis. So they are some important functions of larynx. Here is the structure of the larynx in detail. We can see several of the cartilage structures of the larynx in this side view. Thyroid, what is actually the diagram shows the parts of the larynx. The very important part, thyroid cartilage. This is the thyroid cartilage that contains largest hyaline cartilage and protrudes anteriorly, known as Adam's apple, is usually larger in the male. Actually, this Adam's apple is usually larger in the male as compared to female. Then comes the epiglottis, the spoon-shaped structure, superior, that lies superior opening of the larynx and routes food to the larynx and air toward the trachea. Then comes vocal cords or vocal folds that vibrate with expelled air to create sound or speech, and the glottis, known as opening between vocal cords. and the lower portion, the lowest portion is the cricoid cartilage, and then trachea starts from here. The thyroid cartilage or Adam's apple is usually large in male as compared to female, and so allowing longer vocal cords and contributing to a deeper male voice comparatively. Then comes trachea. Trachea or windpipe is a smooth muscular tube leading from larynx to the main bronchi. The trachea is the passageway for air to and from the lungs. As we can see here, this is the passageway from larynx towards bronchi. It is lined with ciliary hair which sweep foreign matter out of the pathway. It is only about 1 inch in diameter and almost 4.5 inches long. What are important functions of trachea? It connects the larynx with bronchi. It is lined with ciliated mucosa and beat continuously in the opposite direction of the incoming air. It expels mucus loaded with dust and other debris away from lungs, and its walls are reinforced with C-shaped hyaline cartilage, as we can see here in this diagram. Actually, this C-shaped rings of cartilage provide protection on the front and sides. Cartilage rings also prevent crushing of the trachea. After passing through the nose or mouth, the pharynx and the larynx, the upper airways, air enters the tracheobronchial trees. Starting with the air may pass through a few as 10 or as many as 23 generations, or we can say here the branchings on its way to the alveoli. The branchings of the tracheobronchial tree and its nomenclature are shown in this figure. Here, the first 16 generations of the airways, the conducting zone up to here, trachea is the 0 generation and the 1 bronchi, the 2, 3, 4, 5 and up to 16 generations of the airways, the conducting zone contain no alveoli and thus they are anatomically incapable of gas exchange with the venous blood. So we can see here that the just air passes from trachea up to this stage. Alveoli start to appear at the 17th generation. Here, through the 19th generations, in the respiratory bronchioles, which constitute the transitional zone. The 20th and the 22nd generations, they are lined with alveoli. These alveolar ducts and the alveolar sacs, which terminate the tracheobronchial tree, they are referred to as the respiratory zone. And the exchange of gases occurs here. Respiratory bronchioles have some alveoli as shown in this figure. Each respiratory bronchiole branches into about 100 alveolar ducts and 2000 alveoli in the adult human approximately. They are called terminal respiratory units. These alveoli, they are called terminal respiratory units. All of the airways of an echinus participate in gas exchange. The numerous branchings of the airways result in the tremendous total cross-sectional area of the distal portion of the tracheobronchial tree. Though the diameter of the individual airways, they are quite smaller. This can be seen in this table. The diameter is very small here. So the gas exchange is at its best due to the smallest diagram, due to the small diameter. But it provides a very large cross-sectional area. So a large surface area. What is the role of central nervous system in the respiration? Another important component of the respiratory system is the central nervous system role. Unlike cardiac muscle and the muscles of the respiration do not contract spontaneously. Each breath is initiated in the brain, and this message is carried to the respiratory muscles via the spinal cord and the nerves innervating the respiratory muscles. Spontaneous automatic breathing is generated by groups of neurons located in the medulla. This medullary respiratory center is also the final integration point for influences from higher brain centers, for information from chemoreceptors in the blood and cerebrospinal fluid, and for afferent information from neural receptors in the airways, joints, muscles, skin, and elsewhere in the body. The lungs, they are a pair of spongy organs located within the thoracic cavity. The right lung is larger than the left lung and consists of three lobes. As we can see here, the right lung consists of three lobes: superior, middle, and the inferior lobe, which are divided by two fissures, oblique and horizontal fissure. The left lung has only two lobes, the superior lobe and the inferior lobe, and is divided by one oblique fissure only. Each lung has three surfaces, an apex and a base. This is the apex and this is the base. The surface of the lung are the costal, mediastinal and diaphragmatic surface, which are named after the adjacent anatomical structure which that surface faces. This is the ciliary epithelium of the trachea. Each hilum of the lung contains the following portions: principal bronchus, pulmonary artery, two pulmonary veins, bronchial vessels, pulmonary autonomic plexus, lymph nodes, and vessels. The lung occupy most of the thoracic cavity. Its apex is near the clavicle, that is the superior portion, while its base rests on the diaphragm. Each lung is divided into two lobes. We have already seen pulmonary fissure, pulmonary visceral or pleura. It covers the lung surface, as we can see here. Parietal pleura, visceral pleura. First of all, it covers the lung surface. Parietal pleura, it lines the walls of the thoracic cavity, and the pleural fluid, which is filled the area between the layers of pleura to allow gliding. The lungs are two spongy organs located in the thorax. We have already seen. They consist of elastic tissues filled with an interlacing network of tubes and sacs that carry air and blood vessels and carry blood. Each lung is divided into its lobes, as we can see here that the right lung is divided into two lobes and the left lung, being the larger one, is divided into three lobes. The right lung, actually it is small as compared to, sorry, the left lung is small as compared to the right lung, because it has to accommodate the space for the heart. So it has a cardiac notch also here. So it is smaller as compared to the right one. The tracheobronchial tree is a portion of the respiratory tract that conducts the air from the upper airways to the lung parenchyma. It consists of a trachea and the intrapulmonary airways, known as bronchi and the bronchioles. The trachea is located in the superior portion and represents the trunk of the tracheobronchial tree. This is the tracheobronchial tree actually. The trachea is located, the trachea bifurcates at the level of the sternal stage angle, that is T5, into the left and the right main bronchi, as we can see here, the right and the left bronchi. One bronchi, one for each lung. The left main bronchus passes infralaterally to enter the hilum of the left lung, while on its course it passes inferior to the arc of the aorta and interior to the esophagus and thoracic aorta. While the right main bronchus, it passes the right one, it passes into to enter the hilum of the right lung. The right main bronchus has a more vertical course than its left counterpart and is also wider and shorter. This makes the right bronchus more susceptible to foreign body impaction. So if any foreign particle comes in the respiratory system, it would be it would be found in the right lung, as we can see here. It would be present in the right lung. As they reach the lung, the main bronchi branch out into increasingly smaller intrapulmonar bronchi. The left main bronchus divides into two secondary lobular bronchi, while the right main bronchus divides into three secondary lobular bronchi that supply the lobes of the left and right lung respectively. Each of the lobular bronchi further divides into tertiary segmental bronchi that aerate the bronchopulmonary segments. We have already seen this division in the slide number 14 in the table. The segmental bronchi then give rise to several generations of the intrasegmental or conducting bronchioles, which end as terminal bronchioles. Each terminal bronchiole gives rise to several generations of respiratory bronchioles, and respiratory bronchioles extend into several alveolar ducts. We can see here alveolar ducts or alveolar sacs, which lead into alveolar sacs, each of which contains many grape-like outpocketing called alveoli. Since they contain alveoli, these structures mark the site where gas exchange begins to occur. Respiratory tree divisions. So first of all, we can say here that starting from primary bronchi, secondary bronchi and tertiary bronchi. Then comes bronchioli and the final is terminal bronchioli. The bronchi are the two main branches at the bottom of the trachea, providing passageway for air to lungs. What are alveoli? At the end of each bronchiole are the alveoli. The lung contains about 300 million alveoli sacs, which are the air cells where the exchange of oxygen and carbon dioxide takes place with the capillaries. While talking about structure of the alveoli, it contains alveolar duct, alveolar sac, alveolus, and the gas exchange. Now, if we talk about respiratory membrane, that is the air-blood barrier between alveolus and the blood capillaries, it contains thin squamous epithelial layer lining alveolar walls, and pulmonary capillaries cover external surface of the alveoli. The left bronchi is smaller than the right bronchi. As we have already seen, the left lung is smaller as compared to the right lung. So because room is needed to accommodate the heart, we have already seen that if a foreign particle is inhaled, then it usually lodges in the larger right bronchi or enters the right lung. The base of the lungs rests on the diaphragm, a muscular wall separating the thorax from the abdominal cavity. It is involved in the respiration, drawing downward in the chest during inhalation and pushing upward during exhalation. Tidal volume refers to the amount of air that is inhaled or exhaled during normal breathing. That is about 500 ml. And total lung capacity is 3.6 to 9.4 liters in an average male, depending upon the age and the size of the body and the lungs. Pathogens, white cells, and immune proteins present during an infection may cause the air sacs to become inflamed and filled with fluid. This is characteristic of pneumonia, as we can see here some infection and inflamed primary and secondary bronchi. This is also known as acute bronchitis that usually result from infections such as cold or flu. So in the presence of infection, the bronchi sometimes become inflamed. It is important to know that this is the characteristic of pneumonia also, and if both lungs are involved in the inflammation, it is termed as double pneumonia. If someone is unconscious, it's possible to aspirate stomach content into the lungs, causing aspiration pneumonia also. This diagram also shows some inflammation and infection at the level of alveoli that disturbs the exchange of gases then. So the vital signs are essential elements for determining an individual's state of health, which include temperature, pulse, respiration, and blood pressure. A deviation from normal of any or all of the vital signs indicate a state of illness and can be used by the physician in a diagnosis prognosis and treatment. Ultimately, the normal respiration rate for a 5-year-old is 20 to 25 breaths per minute, while for someone 15 years or older than that is 15 to 20 breaths per minute. This diagram shows the exchange of gases between alveolus and the capillary wall. This is the diagrammatic representation of how lungs works to exchange oxygen and carbon dioxide. That is, starting from inspiration, oxygen enters the pulmonary veins, passing through left atrium and left ventricle. The blood goes to aorta, where oxygen is utilized towards the metabolizing tissues and carbon dioxide is produced. The resulting carbon dioxide which is produced goes to veins, passing from right ventricle and right atrium. It goes to pulmonary artery and ultimately expires out from the lungs after exchange process. Thank you. Our today's lecture of anatomy and physiology of the respiratory tract ends here. Thanks.